Welcome to today's webinar, Cities Developing Community-Based COVID-19 Recovery, brought to you by the Tamarack Institute. My name is Justin Williams, and I lead the government and stewardship work at Tamarack. I'd like to take a moment to ground our important conversation in the acknowledgement that we are meeting today on Indigenous land. As settlers, we recognize the contribution and historic importance of Indigenous people and affirm our collective commitment to make the promise and challenge of truth and reconciliation real in our communities. This is important today as we consider the disproportionate impacts that COVID has had on some communities. For our webinar today, we have three incredible leaders in Canada's municipal landscape: Brock Carlton, the former CEO of FCM; Mayor Berry Vrbanovic of Kitchener, who's my mayor, so extra excitement; Mayor Lisa Help from Victoria. And so throughout this pandemic, we have seen amazing resilience from communities and cities. Leaders like Barry and Lisa have recognized the gaps that the pandemic has illuminated and looked for ways to support their communities to unite, adopt new innovations, and harness assets for a just recovery. We're particularly excited about this webinar as we just released 10, a guide for community-based recovery, and it's quite popular, and I really recommend you take a read. Right now, it's my honor to welcome Brock Carlton, who will lead the first part of our discussion. Brock is the former CEO of the Federation of Canadian Municipalities. He oversaw dramatic increases in federal support for municipalities, as well as the recognition of the vital role that cities play in the national interest. Brock is a longtime part of the Tamarack community, a co-author of a guide for cities reducing poverty, and the vice chair of our board. So I'm really excited about this conversation. And so Brock, I'm gonna hand it over to you to lead us through the talk.
Thanks a lot, Justin. Thanks for those kind words and that introduction. So my first job is to introduce the two mayors. And I'm not going to read bios. You can find their bios on their websites. What I want to say is that there's a few things that I think of when I think of both Barry and Lisa. The first one is they're both dedicated to their community. They have strong commitments to doing the very best they can do for their respective communities. The second thing when I think of these two folks is they're both collaborators. They collaborate with diverse voices and diverse groups and diverse interests to find the best way to solve problems in their communities. The third is that they're both thinking mayors. They think about what they're doing. They're curious about what's going on in their community, and they both look beyond their borders at the broader context, whether it's in the region, whether it's politically at a provincial, federal level, whether it's internationally. They both understand that they're operating in a broader context, and they think of what that context means for the best thing in their communities. The last thing I'll both say about them is that they're both really nice people. And they're fun to be around. And certainly in my years as leading at FCM, they were part of people like Barry and Lisa were part of the reason I enjoyed my job so much. So welcome, Barry. Welcome, Lisa. It's really nice to have you here. And thank you for joining today's webinar. Justin mentioned a guide for community-based COVID-19 recovery. It's a very interesting document that Tamarack has released. It forms the basis of a lot of thinking around recovery at the municipal level. And there are examples in there of good ideas and specific examples from cities across the country, cities and towns. This conversation today is to shed some light on how Kitchener and Victoria specifically are taking this opportunity to build more vibrant communities, to build more just communities, inclusive communities, communities that are economically viable and ecologically responsible. So we're going to go through a conversation for the next 30 minutes, and I'd like to start by asking both Barry, but perhaps we'll start with Barry and Lisa, but perhaps we'll start with you, Lisa. What has your city done to better understand the impacts, both negative and positive, of the COVID-19 pandemic? And what have you found?
Thanks, Brock. It's an honor to be here with you and with Barry and with Tamarack. I'll just start by locating myself here in the city of Victoria, obviously, but we're on the Lekwungen speaking people's territories, the Songhees and Esquimalt nations. And what we've done really in terms of assessing the situation is just paid deep attention to some of the voices pre-COVID that didn't get the attention perhaps that were warranted or that was warranted. And tried to really understand, through community engagement sessions, through people who call into council meetings, through letters to the editor, social media, the responses on our own social channels, what has happened to people who were already vulnerable, how have their lives been made even more challenging by the pandemic. It's been a very interesting balancing act, because the people who have access to the tools to speak loudly and clearly are the voices that are often heard the most. And so we've been really working hard to listen differently and to listen to different voices. And what we've seen and heard, some things not surprising, that those who were already vulnerable in the pandemic are even more vulnerable now. That young people, that women, that people of color, that Indigenous people have been having a harder time than those who carry privilege. And so our COVID recovery plan, both at the city and regionally, really takes those things very seriously. We've also, and I love how you said this, and I would agree it's true about Barry and I, that we're always working and looking beyond just our own cities to see what's happening around the province, the country, and the world. And, you know, what we saw last summer with George Floyd and Black Lives Matter, something that people of color, Black people, Indigenous people have obviously been saying for a long time, but it seemed to take on new resonance and wider resonance. And so we've been grappling with that as well as we build back better. How do we also address systemic racism? So that's just an opener, and look forward to sharing more.
I love that idea of her listening differently. That is so important in the context of COVID, but also in the context of all the social dynamics that are happening in our society these days. Barry, you got any thoughts on this question?
Absolutely. Thanks, Brock. And just as we're starting out, I do want to acknowledge that as with Paul and Justin, I am joining you on the traditional lands of the Anishinaabe, Haudenosaunee, and Neutrals people here in Kitchener. And also want to give you and Paul and Justin and everyone at Team Tamarack a real shout out for not only the leadership that you're providing now, but the leadership that folks like you and Paul have been providing for many, many years. I think of my time in public life, and quite frankly, both of you have played an important role in shaping some of who I am as a leader today. So thank you for that. Just building on what Lisa said, and it really is a pleasure to be on this panel with her, because she is one of Canada's dynamic mayors who's doing some great stuff in the city of Victoria. I think for us, really from the beginning, very much the lesson was communication and collaboration throughout the pandemic has been key. We often talk about sort of the barn raising spirit in Waterloo Region, which is built on the Mennonite roots of this area. Former Governor General David Johnston often talked about it. And it was how community came together to deal with the barn after a fire and rebuild it. And that's very much the approach that we've taken in terms of dealing with the challenges around the pandemic, but also in recognizing that marginalized populations have been the ones who have been most impacted. And, you know, I think of early on in the pandemic where members of our Black, Indigenous, and persons of color community came out and said, like, listen, you need to start looking at some of that disaggregated data. And when you do, you're going to see some of those realities. And sure enough, when we actually started looking at those numbers, and communities across Ontario and across Canada started doing that, that very much was the story. And I think that has shaped how we've responded since then. So, you know, whereas before we were looking at things like drive-through testing and so on, and people coming to those centers, more recently we've done some pop-up sites right in some of those communities that are community centers in order to better support those communities going forward. I think for all of us, we've recognized the challenges, the different age demographics have had, the different socioeconomic groups have had, and that our Indigenous, Black, and people of color communities have had, and have realized the importance of working with leaders of those communities in order to shape a better future going forward. And much of the work that we've done over the last while, whether it's through our new housing strategy, our new economic development strategy, and so on, has been influenced by the events of the past year.
Great. Of course, the image of the barn raising is a great image of community coming together and everybody supporting everybody else. It's a wonderful image. both of you have touched in your comments so far on about communication. And I know both of you as really good and thoughtful communicators. So this is a question about communication, and it's kind of, communication is two-way. One is communicating out to people, and the other is engaging and listening and learning from what other people are saying. So the question really is, what is your city doing to communicate to your citizens throughout the COVID-19 pandemic, regarding your work, your recovery plans, your adaptation plans? And the second is, what kind of engagement has your community had? What kind of dialogue have you had with your community, and what have you learned? What reflections, what have you learned from those exchanges? Barry, do you want to start?
Sure. Thanks, Brock. And as you pointed out, and as both of us have said, communication has been really key from the forefront of dealing with this pandemic. And interestingly enough, you picked two mayors that also are operating in environments where there are two tiers of local government. In Victoria, you have sort of the greater Victoria district, and here you have Waterloo region. And certainly in our case, the way responsibilities of local government split up in Ontario, many of the social services and public health responsibilities, in fact, sat with our regional government, which I sit on. And, it's been important to coordinate between those two. So for example, years ago, after SARS, there was a pandemic plan that was prepared locally, and it in fact creates a pandemic control group that not only brings together the heads of council from each of the municipalities, but also other key community partners such as the healthcare sector in terms of the hospitals, our physicians, public health, and so on. Throughout the pandemic, both at the region and here at the city, we've endeavored to have regular communications. The region to this day still does 2 press conferences a week with updates from a public health point of view that involve our medical officer of health and our regional chair. Throughout the pandemic, I've done a series of mayor and council updates by video that I've shared on Facebook. I've done a weekly radio program on Thursday mornings where people actually email in or text in questions to the radio hosts and stuff, and that's gone very well. But we've also undertaken some difficult work. Work with our Indigenous community, work with our Black and people of color communities in terms of creating a new office of anti-racism, Indigenous, and equity. And all of those required us to continue to be engaged with the community, to work with them. And so, while in many ways our emergency plans sort of focus inwards, we recognized that we needed to continue to focus outwards going forward and engage regularly with people as we worked on some of those initiatives.
Yeah, that combination of inward reflection and outward communication is a really important dynamic to sustain engaging your community. Lisa, any thoughts on this?
Sure. Here it's true. We have 2 levels of government. We've got the City of Victoria and the Capital Regional District. Neither of those levels are explicitly responsible for healthcare. So all of the communications around health and restrictions and any changes to restrictions and case counts and all that stuff has been very ably handled by our provincial health officer with a breakdown on a region by region basis. So we've, in early days in the pandemic, we did a Facebook Live every day. I think we did it every day for 57 days at a predictable time. The media would come, they'd ask me questions, but we also streamed it live. We'd have questions coming in from the public. And that was incredibly, incredibly useful. We could get information out in real time. This was, again, early days when everyone was kind of in panic mode. And we found that by doing it, sometimes there was actually nothing to say, but we held the session anyway, just so that we could share, what a senior center was doing or what a community center was doing. So we really did kind of over communicate in the early days. And I think that was appreciated. And then we'd send out a daily release after that. As things became more stable, we moved to kind of communications and engagement on a project by project basis. So during the pandemic, and I think our staff were planning this anyway, but just like many things, they got accelerated. We launched a new engagement platform called engage.victoria.ca. which is, I think, more interactive than in the past. And again, we saw very early in the pandemic, and Barry has already cited this, and I said it earlier, that different people are differently impacted. Bonnie Henry, our provincial health officer, likes to say that we may all be in the same storm, but we're not in the same boat. And so as we rolled out things like everyday creativity grants or neighborhood grants, we reached into communities that we probably wouldn't have deliberately reached into before. Last year, also as part of a participatory budgeting process, we worked with newcomer communities to elicit projects from them. And so again, a lot of this is kind of would have happened anyways, but there was a pandemic related communications approach, recognizing that the people who were most vulnerable probably aren't the ones who we were communicating with as much as we needed to in the past. And one small success, and this is kind of that two-way communication. Every year we do a budget survey when we put out our budget, and this time, for the first time ever, for our 2021 budget, and we did the survey last fall, the demographic of people who responded to the survey matches the demographic of people who live in the city. So 59% of people in Victoria rent, and only the remainder are homeowners. And we had that return on our survey. The same proportion of renters filled out the survey as live in the city of Victoria. Same with youth, same with newcomers to Victoria. So what that showed us is that our efforts to communicate and engage were actually paying off when it came to things like asking people to fill out a budget survey. So that felt like it's a small success, but it felt like some affirmation that our efforts were at least including people whose voices hadn't felt that there was room for them in the city.
Well, that's a great story of inclusion and engagement across the board. I really like the comment you made about communicating, even if you had nothing to say, you were still there, you were present, you were sharing what others were doing in the community, and it probably at that stage it created a sense of calm and consistency for your citizens. Mm-hmm. In the guide for a community-based COVID-19 recovery, one of the 10 ideas is to take an asset-based approach to sustainable change. So I'm just wondering, what are, for perhaps you, Lisa, first, and then Barry, what are the social and physical assets present in your community that you have recognized will help guide you toward your recovery?
It's interesting. They're the ones that played a key role all throughout the pandemic. So daycares, many of our daycares are run out of city-owned community centers by nonprofits, and those have been a tremendous asset, keeping kids in care so parents could go to work or work from home. Our community center network more generally, we've got a very decentralized approach to community centers. So all of the buildings are owned by the city, but they're all run by independent nonprofits, and they've been providing tremendous value, community centers as well as senior centers. And our arts and culture community is another social asset. Again, I mentioned we created, because arts and culture groups have been really, really suffering in our community and in communities across the country. So we created, I think, $250,000 worth of everyday creativity grants, very quick turnaround, very loose guidelines, and all of the money was applied for and allocated. And what we're going to see started last year, but this year, some of these projects roll out, small things like bicycle-powered music festivals, youth mental health and art. Like, maybe I know you guys are going to send out assets afterwards. When the staff brought the list of projects to council, I was like, wow, that's amazing. So we'll see if we can get a list. So those are some of the social assets in Victoria in terms of physical assets. Well, I guess the community centers are both physical and social assets. We have a very compact city. So it's a really, really walkable place already, really bikeable place already. But we are accelerating investments in pedestrian and cycling infrastructure because we saw heavy use of it during the pandemic. And our waterfront is also another physical asset. People love to be there and go there. And so we've made some significant improvements in terms of pedestrian access to the waterfront, a new walkway along there. Our parks are also obviously physical assets. Right now, unfortunately, many of them still have people living in them. because shelterlessness is still an ongoing issue here, which we're working to resolve. So those are some of the assets that we will be building on. But what really, what I would put a fine point on is the social assets, the nonprofit sector, the arts and culture sector, the community center operators. They've really shone throughout this pandemic, and I'm sure that's the case across the country as well.
Yeah, that's so interesting. Your comments take me back about 10 years to when FCM put out a report on the social infrastructure and the importance of social infrastructure and declining social infrastructure in the country. It's just interesting that you highlight that as an important part of your asset base as you think about recovery. Barry, any thoughts on the assets, physical and social?
Yeah, absolutely. I mean, I think first and foremost, I really want to start on our people, our people at the city and our people in the community, who were such an integral part of really tackling the challenges of the past year, and also planning for the recovery that we're all looking towards. And I'd be remiss if I didn't give a shout out to my incredible council and our municipal leadership team, who really have all gone above and beyond in terms of helping in a collaborative way lead through this challenging year, but also at the region. Our chair Karen Redmond and the staff team there and council, and how collectively everyone has taken on an approach that's really built on the culture of this region, and that's a culture of caring for one another, and that I think really speaks to strong social capital for municipal leadership, but then also in terms of many of our organizations. I think of the work, and those who are watching from the local community will know of the House of Friendship and the leadership role they played as we had to reinvent our shelter system to create more space and to create safer space. And so we used a hotel to deal with that, and they developed what's become known as shelter care, which has really brought in not only the overnight shelter care, but also the healthcare supports, the mental health supports, and so on. And so all of a sudden, we were starting to see remarkable response from some of our most vulnerable individuals because of the approach that was taken to dealing with them. And now we're looking at how do we use this as something to build back better going forward. From a city point of view, certainly we had a strong system of physical assets that we could use, like our community centers that then became food distribution program places for pop-up testing, warming and cooling centers that needed to be provided when much else was closed. We reimagined our customer service counter strictly on the main floor of City Hall in order to support the community. But even things like our Kitchener Market reinvented itself by creating a new mobile ordering program where in fact people could say, okay, here's the stuff I want. They actually went and boxed it for you from all the different independent vendors, charged it against your credit card, and all you had to do was drive in and pick it up. So the innovation that this region is known for is something that we've really used to our advantage, both in terms of reinventing things socially and physically. The last point I really want to make is, as we were moving from the first wave to the second, we really recognized the impact that mental well-being was playing both on our staff and in the community, and identified that as a priority as a municipality in order to make sure we were looking after our staff, but also with our community. And so we partnered with Workwell at the Y of Three Rivers. It's actually a new branch that's opened at the Y, and it's led by Jim Moss, who used to be with Plasticity, which was one of our startups locally that focused on the role of happiness in our organizations. And they've been doing incredible work with all sorts of organizations around mental health and well-being, and we partnered with them both in terms of some of the work we're doing within our organization and throughout the community, and also created a program during the winter months to get through that second lockdown called Reimagined Kitchener. And it's been great to see how the community's responded. The last number of weeks, as an example, we've had a pop-up Elvis on the back of a pickup truck traveling around in different wards on different streets. And the feedback from people as Elvis shows up on their street, and people are on their porches and their windows looking out and coming out dressed, onto their driveways and dancing away, has just been amazing. And it's those kinds of things that I think are so important during challenging times like this.
And is the mayor one of the pop-up Elvises?
I am not the pop-up Elvis. We were talking about earlier, we've done a Kitchener safety dance locally with the help of KW Glee. That was another initiative to make all the public health measures fun. And they relied on old 2 left feet to record the first video, and so that was quite the moment, let me tell you.
Well, you both touched on what I would have expected you to touch on, which was about people and about caring. That's really important. It's one of the reasons why I find the two of you so engaging and important as leaders in this country. I want to just shift a little bit our mindset towards more specifically the recovery and ask the question, first of all, start with you, Barry, then Lisa. What does recovery mean for you? And how does your recovery plan focus on social recovery in addition to economic recovery? And how do you rebuild the support for the social infrastructure that you both have talked about, and build the support for the folks who have felt isolated in this time of pandemic? So Barry?
Brock, I mean, it's been really interesting to tackle a variety of these issues. I'll start with the economic end, because we were in the process of actually doing a new economic development strategy. It was actually going to launch about a month after the pandemic started, as part of my State of the City speech last year that obviously got canceled because of the early months of the pandemic. But we also had to put a pause on it because we recognized the world was going to look very different coming out of it. And so we actually used that to help shape what things are going to look like over the next while. So we created both a short-term strategy and a long-term strategy. And the short one has allocated $5 million out of a $110 million fund to actually support economic recovery. But some of the things that we're looking at is, how do we do a better job of supporting women-led businesses? How do we do a better job of supporting businesses that are being started by the Indigenous, Black, and people of color communities? What do we do for our youth in that regard? And so that's part of our economic recovery program coming out of COVID. And then there were 5 areas of long-term investment: health innovation, creative industries, a citywide startup network, affordable and attainable housing, and a vibrant and active city. And that really has, the other 105 million allocated towards it. And we've made a number of substantive investments already, including a new health innovation arena with the University of Waterloo, as well as a project with the YW and the federal government's Rapid Housing Initiative, where we're going to be building some supportive housing for women together with the YW on land that the city of Kitchener owns in conjunction with the region and the federal government. So that's the economic piece. On the social piece, we've really been moving forward on our work with our new office of Indigenous issues, anti-racism and equity. We're in the midst of hiring the director right now. Many of the issues that for many years were talked about really came to the forefront, as Lisa and I have both mentioned earlier, partially because of the situation with George Floyd, partially because of what became known as Land Back Camp, which was an initiative of some members of our Indigenous community in two of our local parks in Kitchener and Waterloo last year. And we've really been working now to make some significant progress, both through a new strategy on EDI at the city, as well as our work with the Indigenous community going forward, and that's going to be a big part of our recovery.
So interesting. You start your answer with questions. You know, your curiosity about what other groups in their community need the kind of support for economic development. It's great orientation, because learning from others. Lisa, any thoughts on this?
Well, it's very interesting because I could just say ditto to what Barry just said, which is like, it's actually kind of a little bit, it's interesting. We were also just about to launch our economic action plan, literally, and then COVID hit, and then we had to go back and look at. So it's very interesting how similar those stories are. So, but what I will say about both our regional plan and our local plan, I just want to flash both up here. That's Victoria 3.0. That's our local economic recovery plan, and then this is Reboot. And again, we can send these out as resources, but each city and region will have their own. I think that we're not conceiving of economic recovery and social recovery as separate from each other. We know that unless they are integrated, there won't be recovery. And I'll just give you 3 examples as to what I mean by that. So just like Kitchener's strategy, and again, it's interesting to see how similar, and maybe because Barry and I have a lot in common, our strategies end up looking a lot in common. But we have dedicated in Victoria 3.0 to support sections on youth business, Indigenous business, and newcomer business. So there are deliberate strategies for each of those groups. So that's one example. Secondly, in the regional economic plan Reboot, that was a tremendous amount of work by our regional development organization, which I sit on, and most of the mayors in the region do. But there were 10 working groups, and one was an inclusive economy working group, and another was Indigenous economy working group. And the Indigenous Economy Working Group, one of the key recommendations that came out of that was actually to create an Indigenous Prosperity Center with the 10 nations that are in the region, who are all also members of the South Island Prosperity Partnership. So again, social and economic recovery, very, very integrated. And then, tangentially, because it's not exactly about economic recovery, but we've formed, myself and the Mayor of Kelowna, the BC Urban Mayors Caucus, because we're all struggling, and this is the same in Kitchener, I know it's in cities across the country, with people who are on our streets, who don't have anywhere to go, who have complex mental health and addictions issues that aren't being serviced by any current service that's available, whether it's supportive housing or anything else. In the case that we're making, both to the provincial government and with FCM to the federal government, is that unless we get these people the care they need, they're going to continue to live in our downtowns. They're going to continue to live in our streets. They're going to continue to have mental health and addictions episodes in our business districts, and that's not going to be good for economic recovery either. So it's not exactly an economic recovery action plan, but we need the people who have the most chronic needs, who are most vulnerable, who aren't getting the health care they need. They need complex care facilities or something. That's not there now. And if those things aren't provided, economic recovery in our downtowns across British Columbia is going to be a big challenge. So those are some of the examples I would give.
Yeah, thank you. We're just about to shift to questions from folks who are on the line. So I'll just thank both of you. We could continue this conversation for a long time, but it's fascinating to have this discussion. I heard a lot of commonality around orientation on social justice, around orientation towards people, and really caring for your communities. Both of you, as I said at the outset, and you demonstrated this very clearly, is a collaboration with different voices and different actors in your communities to build solidarity and build good ideas and creative ideas that look for solutions to the community's needs. Really, really well done. I feel both your communities are in good hands, as I knew they would be, with the quality of the two of you as mayors. So Justin, I think it's time to turn it over to you and to ask for questions from the audience.
Thank you so much, Brock, and thank you to the mayors. This has been really, really engaging. So I'll handle the first question, I think, first. Just there's a question about getting copies of the SARS pandemic plan and the recovery plan. So I will promise that in the follow-up email, I will send those out to people. And so we can turn into some of the questions that we've got in. And the first one is from an anonymous attendee who's actually a former resident of Kitchener, now a resident of Victoria. So that's exciting. Just wondering how I guess all of you see cities. How will cities look different in 10 years as a result of what you're doing on the ground now? I guess we'll turn to Barry first.
Sorry, how will cities look different?
Yeah, how will your city and your community look different because of the work that you're doing right now?
So I think it'll obviously the community is growing. The last couple of years, I mean, we were one of the fastest growing areas, and one of the challenges, and I imagine this is probably true in Victoria as well. People have been over the past year in fairly significant numbers moving out of Toronto and the GTA into areas like ours and up into, sort of, I won't call it the north because the north will be, Northern Ontario would be insulted if I called Collingwood and Muskoka as the north. Brock will remember those conversations during his FCM time. Yes. But my point is that there has been a move, and as a result of that, I think we're seeing more people coming into our communities, which is creating some real challenges on housing. And you would know this, Justin, as well, in the housing prices locally. And this is probably one of the things that most keeps me up at night in terms of how do we work with the other orders of government to make sure that we have a good continuum of housing options and affordability for people across the spectrum. And so this is something that I think our new housing strategy will help towards, but there's a lot of work that's going to need to happen at the provincial and federal government on that with us in order to make that happen. And FCM has been a great champion of that, along with the Big City Mayors Caucus and others. And so I really want to acknowledge the federal government in terms of what we've been able to achieve with the National Housing Strategy when Brock was still there, and the work that we've done now under Carol's leadership and the board. Garth Rizal, who's a good BC boy and is our current FCM president. But I also think, we are putting a focus on issues that have impacted the Black, the Indigenous and persons of color communities in a way that we never have before. And I think we are going to be a more socially just and equitable community 10 years from now in ways that, quite frankly, I don't think would have happened as quickly without the pandemic. And so I'm encouraged by the doors and the opportunities that have come from what has been a very challenging year.
Thank you, Barry. Do you have anything to add, Lisa?
Sure. I'm just going to be really quick because I've scanned. There's lots of good questions. I want to make sure that we get to all of them. So Victoria, I think, will be better prepared for another pandemic or climate catastrophe or whatever else might be coming our way, because we're really deliberately building resilience coming out of this. We give strategic plan grants every year, about $500,000, and this year's grants, and probably hopefully for the future, are focused on, tell us how you're going to build resilience, whether it's at the neighborhood level, the community level, the level of your nonprofit. So I think we'll be a more resilient community. Housing is also a challenge. So my hope is that 10 years from now, it'll be easier to build a townhouse than it will be to build a single family home. Right now, it's the opposite. It takes, sometimes 2.5 years just to get through all the process to build 21 townhomes. Whereas if you knock down a single family home and want to build another one, you can do it without going through any political process. I think 10 years from now, we'll have a completely built out cycling network so that 90% of our population will live within 500 meters of an all ages and abilities network, so that kids, seniors, people who wouldn't get on bicycles otherwise will be able to get around the city, reduces emissions, increases health outcomes and all of those things. And, hopefully in 10 years from now, We'll have, through the Equity, Diversity, and Inclusion Office that we've also created here at the city, more equity, diversity, and inclusion, both at City Hall and in the community, and to be a more welcoming and less racist place.
Wonderful. Thank you so much.
Can I add a thought, Justin?
Absolutely, Brock.
I mean, I'm not running a city, but to me, the question is, what's the country going to look different? How's the country going to look different in 10 years? And that is partly about the reality, and it just, this whole thing shines a spotlight on the reality that things happen in the cities and towns. And for the federal government to achieve its objectives, it has to work more closely with the cities and towns. And whether it's through existing mechanisms that support housing or infrastructure or climate action, public transit, et cetera, those links need to be strengthened and expanded for the benefit of the country.
Really, Brock. Great addition. Our next question is, what do you see as the role schools will play moving towards a new normal outside of just educating children? So the role of the schools in the community.
Lisa, do you want to start?
Sure. Yeah. Our schools, most of our schools really feel like community-based schools or community centers. Many of our schools actually have community centers attached to them. Many of our schools have out-of-school care running out of there by a nonprofit. So it's interesting. It's a great question. I really see our schools as almost part of our community center network. Our PACs are very engaged, our parent advisory councils. Before COVID started and we couldn't have in-person meetings, I would go see each of the PACs on a regular basis. So the parents are really engaged. So I see schools as part of schools and teachers and parents and the kids as part of the really building resilience at the very grassroots. Our schools aren't separate from, you know, our community engagement. One of our markets actually Barry talked about the Kitchener market. Moss Street Market actually happens at a school site. So I think we'll continue to see schools play a strong role in the community just as they did pre-pandemic. Yeah, I'll leave it at that, but they've been very active participants in our community for many years.
So yeah, I mean, locally, we've also had a great partnership with our two school boards, whether it's been, you know, over through shared use of schools, as well as, quite frankly, building some of our library branches and community centers directly attached to them so that we can actually benefit from, you know, each other using those facilities at different points in time. I think those schools have so much more potential, quite frankly, and the provincial government is recognizing this. And so they're trying to really see them more as neighborhood hubs going forward. And I think that will only further allow us to strengthen some of these neighborhood level connections. One of the initiatives, and Paul knows about this, that we did a lot of work on at the City of Kitchener was our Love My Hood initiative. A few years ago, and that continues with grant programs and so on. But it's really recognizing that, you know, at the end of the day, it's that your local neighborhood, however you defined it, that you connect with, and how do we support people and support those individuals and resources in those neighborhoods to really serve the community in the best way possible, recognizing it's not a cookie cutter across the city.
Thanks, Barry. Brock, is there anything you want to add, or do you want me to? Okay. Just because it's been sort of brought up, the needing to work with and assess and support for underrepresented and underserved populations. One of the questions is, what methods are you using to reach out to underserved populations? How do you engage them and assess their needs and develop outreach and services to meet those needs? And we'll start with Barry this time.
Sure, thanks. And Justin, I mean, it's been an evolution, quite frankly, throughout the pandemic. Some of it is through reaching out to leaders in the organizations that are working with those particular communities. Some of it is through our conventional ways, like Engage Kitchener, Engage Waterloo Region, on some of the work that we're doing. But some of it is also recognizing that, in fact, you have to maybe take the accelerator pedal off some of the work you're doing and actually pause the consultation process, because one of the things that we're hearing is some of those communities who are dealing with the pandemic in the most challenging ways, quite frankly, going to them to consult right now when they're already holding down 3 part-time jobs and trying to make ends meet and perhaps dealing with COVID-related illnesses, now's not the time to dump on them with additional requests for engagement. And so we're adjusting some of our work plans in some areas, not stopping the work, but just changing the work plans so that we can, go back to those communities and do that important work later in the process, when they're going to be in a position to be better engaged.
We use task forces a lot. So right now we're working on a welcoming city strategy to make Victoria more welcoming and less racist, to focus on anti-racism and a welcoming city. And so we've created a task force which is primarily comprised of people of color, Indigenous people, Black people, people who have been left out of those conversations historically about what should a city be like and who should a city be for. And it's both to focus on our operations at City Hall, but more in the community. So that's one method to create task forces. We also have an active transportation task force, a seniors task force, an accessibility working group, and a renters advisory committee. So we deliberately convene people in task forces to give direct advice to staff and to council, and that's worked really well. It is a lot of work to convene those task forces, but it gives people real political voice. The other thing we've done in terms of homelessness, we've contracted with the Greater Victoria Coalition to End Homelessness to go out into the parks and learn firsthand from people what do they need. We also have hired a homeless advocate at the city to look at systemically what are some of the gaps. And again, she goes out and sits with her notepad and sits beside a tent and is like, okay, tell me your story. How did you get here? What's working? What's not working? What could be better to make the system better? So we do a lot of that kind of frontline engagement, going to where people are and or inviting them to be in task forces. And in some cases, with the Songhees and Esquimalt Nations, we have had a long-standing, this could be an hour-long discussion unto itself, so I won't go into it all, but a city family, which is kind of an Indigenous way of convening. And we compensate the Indigenous members for spending time with us, to pay them, because I think Barry's point was a good one. People are already working hard. Asking them to come and give us more time is sometimes not reasonable. So anyways, yeah, let's have another session sometime on this exact question, because there's lots to say.
Thank you so much. Our next question is just hitting, I think, still on that role of conversation and consultation, the role of the neighborhood level engagement in developing the recovery plans in your communities. I'll turn to Lisa first.
We've got a very strong neighborhood network in Victoria, because our city is geographically a streetcar network. It's the original transportation form, and the streetcar stops had nodes built up around them, and those nodes are still our contemporary neighborhoods to this day. So each neighborhood has a village. Most neighborhoods have a village center, and then density organized around that. So our neighborhood associations have been really pivotal in terms of getting information out, sharing ideas. And then again, a lot of our funding goes directly to neighborhood centers, and then our neighborhood grants, our strategic plan grants. So our engagement is more around, well, we do a lot of engagement around land use. So this development is proposed, give us your feedback, but we've got a kind of decentralized and centralized approach. So we've got each of the neighborhood associations, but then there's the Victoria Community Association Network. So they all come together. And so we've got a really good, healthy dialogue. In terms of development of the recovery plan, I would say that the neighborhood associations per se haven't helped, develop the recovery plan specifically, but through the work that they've been doing all throughout the pandemic, some of the, there've been a lot of neighborhood grants given out. They're actually just doing the recovery plan. They're building resilience. So they're, we haven't had to ask them what to do. They just know what to do, and then we give them grants to resource their work.
I'll keep it simple and say almost ditto in terms of what Lisa was saying. We're fortunate to have an incredibly strong network of neighborhood associations around the city that actually sort of deal with the larger neighborhood areas. And then when you mix that with our work with the Love My Hood program and some of the block based grants and so on, or several blocks that come together for different initiatives. They've just continued the work. It's been remarkable to be able to partner with some of our neighborhood associations on things like our online programming and so on over the past 12 months. So while some of it has been city-led, other parts have been really led by the neighborhood associations on their own. And they've also done some really cool things. So I think of the Standing Park Association as an example that have recognized not everyone has as a backyard or whatever, but when outdoor groups of up to 10, were okay and safe, they actually launched a program with some outdoor heaters, some safe heating in a condensed space, and people could book it and bring their immediate family together in order to be able to enjoy that during some of the winter months, which was those kinds of initiatives were really cool.
Hearing both those answers, what really I hear there is that really important piece of creating the social infrastructure before you necessarily always need the social infrastructure, and just how valuable that's been. Which I'll say as a resident of Kitchener, I definitely hear, and as a part of my neighborhood association. So it's great that it's there.
Awesome.
I'm gonna make sure that I bring Brock in for this next question too, because it's just thinking about wanting to not miss out on an opportunity to learn about what's happening in that. There's a question about if there's interest or if there's work being done to engage with researchers to evaluate the impacts of the interventions you're putting in place for recovery. Just thinking again about the opportunity that's there. So I'll start with Lisa, but I want to also, I think, hear from Brock's experience too, to think about how to engage in that research capacity here.
Yeah, it's a really great question. And the comment after the question, which I couldn't agree with more, is I think there's an exceptional window for intervention research right now. It'd be a shame to miss out on the potential learnings for future pandemic emergency health threat events. That's a great point. I think one of the things that cities don't often do enough is engage researchers and measure impact. So we're doing this on two small projects. Well, one isn't that small, but this was pre-pandemic. We're partnered with Simon Fraser University, who's researching the impacts of our bike network on health outcomes, on ridership, on gender equity, on a whole bunch of different things. So that's interesting to watch. And then we've got another initiative that's island-wide, but started by myself and a couple of other mayors, the Coastal Community Social Procurement Initiative, which is now pivoting to a recovery, more of a recovery focus, helping local governments develop social procurement policies so that as our local businesses are struggling and youth and Indigenous people of color, women, others have lost their jobs, how can we use our municipal spend to benefit those communities and those businesses? So and we're partnered with Royal Roads University, who is going to do an assessment of social procurement and whether it's having the impact that it's meant to. But I think that the question is a really good reminder to maybe look at some of the other things we're doing and see what more could be studied. I think that's a really important intervention, and I'm glad that person shared that there.
Maybe from my perspective, just very quickly, and I see behind Lisa is the Sustainable Development Goals poster, and I got the soccer ball behind me, and I say that because I think there's a piece here that connects with that connects with the work that the World Council on City Data is doing, and really getting at some of the actual data and facts that really can influence where we're going in our work in these areas. Our strategic plan this term of council is actually built against the SDGs. And so I think that is something that we want to continue to build on going forward. I think there's great opportunity to partner with academic institutions and others in this work. We've already done some of that with some academics at Laurier, looking at issues of air pollution as well as contents of sewer data and how that is identify certain things in terms of COVID prevalency and so on. And so all of that is stuff that I think we want to build on, but especially the social pieces. And so if there is those who are on the call that are interested in working with us, please reach out afterwards. Justin can, I'm sure, share our contact information with you. It's not hard to find, just Google Lisa or myself, and we'll be happy to help out. And I know FCM is doing a lot of great work in this space as well.
Thank you both. I'll open up Brock too, if you wanted to add in as well.
Yeah, sure. I mean, yes, the answer is yes in terms of the opportunities for researchers to shed light on impacts. The questions I have are really what happens to that knowledge. And I have two thoughts on that. One is, or not two thoughts, but two things in my mind. One is that I think this may be an old story for folks, but about 6 months before the pandemic broke, there was a global modeling of how we would respond to a pandemic run by the WHO. And they played it all out. They did a whole thing on lessons learned and what to do in the case of a pandemic. And virtually nothing, as I understand it, was followed when we actually got into the pandemic within 6 months of the modeling exercise. So it's actually listening and taking and learning from the research that's done. The second thing is that are you prepared to, like research will shine light on inadequacies that are in a community or in a society. And to address that, you've got to shift your resources. And do the people who have the resources, whether it's governments or private sector or whoever has the resources, are they prepared to not only listen to the research, but shift the resource priorities to respond to the knowledge that research has unearthed?
Thank you so much for that. That's brilliant.
Sorry, if I can just on what Brock said there, I think the other part is, yes, there's going to be an accountability of leadership around this stuff, but governments also need to know that they can actually share that information in public ways to make change for the future as well. Because if society's not willing to accept that, that's going to be a big problem because we won't learn anything then.
Oh, absolutely. Yes. Thank you both for that. I'm just looking at our time and realizing that we are just about at 2 o'clock. So it's my unfortunate job to then wrap us up. So I want to thank the three of you for this incredible conversation. And thank you for the work that you've done in cities broadly, but in both Kitchener and Victoria throughout the pandemic to build back that recovery and to be examples for how communities can be engaged and brought into the conversation to build up. So I think that's been really, really fantastic.